Welcome to The Explainer. Today, we're doing a deep dive into a really fascinating and, believe it or not, incredibly common bacterium, Helicobacter pylori. We're going to unpack everything, how it causes disease, how we hunt it down, and the complex strategies we use to fight it. So get this, there's a microscopic organism that has set up camp in the stomachs of about half the people on Earth. What is it? Well, it's Helicobacter pylori. And it's a true master of stealth, profoundly linked to stomach diseases. Really, understanding how this thing thrives is our best shot at tackling some of the most common GI conditions out there. So here's our game plan. We'll start with the disease itself, then get into the detective work of finding the pathogen. After that, we'll talk treatment, some special cases, and prevention, and the really serious long-term risks. We'll cap it all off with a quick knowledge check. All right, let's jump right in. At its core, H. pylori is a master of causing chronic inflammation. You can think of this persistent low-grade irritation as the root of all the trouble that comes later. This ongoing inflammation is called chronic gastritis, and it is the absolute #1 hallmark of an H. pylori infection. It's the smoldering fire that can eventually flare up into more severe problems like peptic ulcers. But here's the crazy part. Despite its potential for damage, for most people, the infection is completely silent. They have no idea it's even there. And this is where it gets really interesting. The clinical picture is totally different depending on age. In adults, it's often what you'd expect, clear signs of gastritis or ulcer disease. But in kids, the symptoms can be way more vague. Maybe some stomach pain, maybe anemia, maybe just reflux. It makes the diagnostic puzzle a whole lot trickier to solve. So how do we actually catch this stealthy operator? Well, it takes some serious precision, and it all starts with getting a direct look inside the stomach. This is where the real lab detective work begins. We're talking gastric biopsies from very specific parts of the stomach. These samples then go onto a special Pylori agar. This bug is picky. It needs a unique, low-oxygen atmosphere to grow, and it takes its time, sometimes up to a week. Once we see suspicious colonies, we put them through the classic micro playbook, a gram stain to check for gram-negative rods, then oxidase and catalase tests to get our final confirmation. Now, here's a super important point. Growing the bacteria in a culture gives you 100% specificity, meaning if you grow it, you know for a fact the patient has it. But its sensitivity isn't perfect. Sometimes the bug is there, but it just doesn't grow. That's why the gold standard isn't just one test. It's about combining methods like culture plus histology to make sure you get a truly robust and accurate diagnosis. Okay, we've got our positive ID. The next question is, how do we get rid of it? And this, my friends, is where the battlefield has gotten a lot tougher, mainly because of growing antibiotic resistance. It means we have to be strategic. For someone who's never been treated, what we call therapy naive, the first line of attack is a powerful triple therapy. It's a 1-2 punch of antibiotics, clarithromycin and amoxicillin, plus a proton pump inhibitor, or PPI, to lower the stomach acid and help the antibiotics do their job. But if that doesn't work, or if the patient has a penicillin allergy, we have to bring out the big guns, a bismuth-based quadruple therapy. It's a more complex regimen for sure, but it's designed specifically to take down those tougher, resistant strains. Now, this challenge isn't just about a single patient. The problem of H. pylori ripples outward, affecting children, entire households, and demanding a real public health response. So let's break this down. In kids, where up to 15% can be infected, if the first treatment fails, it's absolutely critical to get a culture and run susceptibility testing. We have to know what we're fighting. As for spread, it's mainly person to person, usually within a family, which means simple hand hygiene is one of our best weapons. And in a healthcare setting, we have to be vigilant about things like improperly cleaned endoscopes, and there's a mandate to report highly resistant strains to public health authorities so we can track them. You know, that reminds me of a little piece of wisdom from a senior bacteriologist I used to work with. She said, "It's simple. Just wash your hands like you're trying to prove a negative gram stain, thoroughly and with careful attention to every detail." It's a bit of lab humor, but it perfectly captures the kind of meticulousness we need. So, what's the big deal? What happens if these infections are just left to simmer for years? Well, the stakes are incredibly high because the long-term consequences can be truly severe. If you look at the whole spectrum of issues that GI pathogens can cause, H. pylori is the undisputed king of one particular domain: gastric cancer and ulcers. That relentless, chronic inflammation we talked about, it creates a direct pathway to these very serious conditions. And this is precisely why all of this matters so much. The chronic gastritis from H. pylori isn't just a bit of stomach discomfort. No, it's a recognized precancerous condition. Its direct, proven link to duodenal ulcers and gastric cancer elevates it from just another common bug to a major public health enemy. The road from a manageable infection to a life-altering disease is very, very real. All right, that was a lot to take in, so let's do a quick fire review to help lock in the most important points. Ready? First question. You isolate a gram-negative microaerophilic rod from a gastric biopsy, and it's causing chronic gastritis. What's the most likely culprit? And the answer is, of course, Helicobacter pylori. That specific rap sheet, the gram stain, the rod shape, the unique oxygen needs, it's the classic signature we look for in the lab. Okay, next up, treatment. When you're dealing with an adult patient who's never had therapy for H. pylori before, what's our go-to first-line regimen? That's right, it's the classic triple therapy: clarithromycin, moxicillin, and a proton pump inhibitor. That combination is the established, evidence-based frontline attack for a new infection. And for our final and maybe most critical question, when you think about the most severe long-term risk we discussed, what type of cancer is most directly linked to a long-term untreated H. pylori infection? The answer is gastric cancer, more specifically gastric adenocarcinoma. And this really drives home the point that finding and eradicating H. pylori isn't just about managing gastritis. It's a fundamental strategy for cancer prevention. So this leaves us with a final, really provocative thought. We have a bacterium that lives in half the people on the planet. Given its risks, is it an enemy we need to completely eradicate? Or, as we learn more about the complexities of the human microbiome, will we need to shift our strategy to one of careful management? Is it a foe or a complicated resident? That's a question scientists are still grappling with, and the answer will shape how we deal with this ancient companion for years to come. Thanks for joining us on The Explainer.